Good afternoon, everybody. Thank you for joining the webinar. For those of you who don't know, my name's Steph. I was practice manager and cluster lead in a practice in South Wales for many years. And a bit of information for you about the app itself before we show you a demonstration. So about 18 months ago, we formed a focus group of GPs, cluster leads, patient participation groups, and some health board staff. And we got a wish list of from everyone of what they wanted in a patient-facing app, and we've built the app. They wanted ability to communicate digitally with patients, and patients in particular wanted information brought into one place. We've got a website which patients described as kind of window dressing for the surgery. So we have a website, don't we? But patients wanted more interaction with the GP surgery, and they reported that we send them to lots of places when we sort of refer them to patient.co.uk or a lot of different things. They wanted everything brought into one place. So the app does exactly that. It brings everything into one place for your surgery, so you can communicate with your patients far more effectively. So we'll now share the screen with you, and then you can see how the app does look. Okay, so this is the app as it would be. Downloaded by the patient. So this is a desktop version. So if I go into the development mode, this is how the app would look for a patient on their smart device, i.e. a smartphone or a tablet. And this is how they can control. But for the purpose of this webinar, we'll use a full screen. So I'll try and make this as quick as possible because I know you guys are all busy. But Grange Road Surgery and Grange Road Cluster are the fictional surgery and clusters we've used for this demonstration. So this is the app's homepage. You can see at the bottom here we've got 4 icons. This is a dashboard, which is the homepage. We've got health resources, your surgery, and what's on. So we'll quickly go through each aspect of the app. The app is accompanied by a practice management dashboard, and it's pretty easy to use, but I'll show you the app first of all. So patients can call you, and when they click this button, it enables any call button enables the mobile phone or smart device to call the number instantly. Okay, so when they scroll down, if you do use an online service or triage provider, such as Accurx, eConsult, or Ask My GP, there are others such as Engage Health and Clinic. We do integrate with all of them. So when a patient clicks on the consult with your doctor online, they click here, then they're taken off then to your online triage portal, which is for your surgery. In the app, if you do change supplier in the future, so in the dashboard, for example, if you change to eConsult or Ask My GP, if you just click save there and then click save, if you go back into the app now and refresh it, then that does update the app, and you'd update your link as well. If you don't use an online triage provider, don't worry. In the app's dashboard, anything that's enabled with a tick here will be visible in the app. So as we can see at the moment, we've got online triage available, check your symptoms, book appointments online, order medicines online, and register for online services. If you didn't use any of these, such as if you don't have online triage, or if you suspended appointments during this time of COVID, then you can simply untick these, save that, and then if I go back into the app now and refresh it, you can see now that the ability for the eConsult has gone, and the ability to book appointments online has also gone. So it does kind of future-proof you, and you can be as flexible as you want to, or you don't want to be with regards to the circumstances at the moment. So yeah, so that's that. So patients can link off to your online triage provider, whichever one you do use. Check your symptoms. So we do link with the NHS online symptom checker. Patient can check their symptoms here, and then it tells them what to do, i.e. go to visit your GP, pharmacy, MIU, A&E. If you do offer online booking of appointments, the patient can click here, and then that will take them directly to My Health Online if they are already registered. That's EMIS or Vision. And again, the same with order repeat medication. If you are using a repeat system, you can link off to My Health Online. If you have your own repeat system, I know some websites have their own, you can link to that in your website, and you can do that by just simply updating the link in the meds there, and that whatever is in the link will direct patients off to that repeat medication service then. Registration for My Health Online. So traditionally, patients have come into surgery and then they fill out a form, shown 2 forms of ID, and then you go through the registration process. But it's we want to make that a bit easier for patients, particularly now under COVID rules. So patients can register now for My Health Online through the app. They click here, and then they go through the registration process. I can't show on the desktop version, but they fill in their details here, and then they consent to receiving SMS and text and sign up, and then that will open up the phone's camera, and they're asked to take a form of ID, i.e. passport or driver's license. Then it opens up the camera again, that saves the image, opens up the camera again, and they take a form of proof of address, and then they record a short 5-second video saying, "This is my name is, and I would like to register for all your online services." Then that's submitted through the app securely to you. You get an email notification to say that the patient has registered with you, and then that comes through in the registration section here. This is a test patient for us, so we don't have any tests at the moment, but you can download, and the form comes up as it would for My Health Online. And then you can go through the same registration process as you normally would. The video does help you to validate the patient for all of your online services. So the video is a good representation then of the photograph the patient sends in, i.e. the passport, European driver's license or UK driver's license, and then that does validate everything. So if you are using eConsult or Ask My GP and you haven't validated patients yet, then we've sort of copied what NHS Digital in England have done, and then the video validation validates the patients for your services. Then we've got a health resources section which patients can access from here or from the main menu. Then we've got latest news. So if you have got news in your surgery, you want to tell patients about it. You've got a new doctor starting, or a new member of staff, or you've got a coronavirus update, you can put the news here, and it's pretty simple to do that from your dashboard. You just click on news and click on add new. You can put a photo if you want, and you can put expiry date, title, and the body of the news, and just save that, and then that would appear then in the news section for your patients to see. Other links: need help getting online. When we did do this with do the research with patients, a lot of patients said that some may be tech savvy, not so tech savvy patients. We didn't want to exclude them, so we have partnered with Digital Communities Wales and the Good Things Foundation. Again, this does size better on a phone. The patients can click on the learn more, and this takes them then to a free resource we've secured for the patients called Learn My Way, and it helps patients with simple things like using a keyboard, using a mouse, using a touch screen, online basics, and then getting help using GP surgeries and NHS resources. But anybody who needs help, and this again is available in English and Welsh, as is the app. The app is available in English and Welsh for patients, but this is a free resource patients can access, and then once they go into a module, they can tick it off at their own pace, and they can then tick to say, "I've learned how to use a mouse." So that's a really good resource just to help with digital inclusion across the locality as well. Then you can put other links there: local pharmacies, what the service they offer, GDPR statement, whatever you want really, and you can build these other links again from your practice dashboard. You can build pages, and then you can add new, and then you can just select where you want them to go. Then it's pretty easy and self-explanatory how to do that. We've built this to be as user-friendly as possible, really, for you guys, for the practice managers and the patients. Okay, so that's the home page. Next, we go on to health resources. So resources are NHS resources we've brought into the app, which are national, such as cancer. We've worked with a consultant in Hywel Dda for cancer resources, your treatment options. We've linked with Macmillan Cancer Support. There's an online community that links patients off to the online community then, so they can have that support. There's lots of resources on all the topics really, but we know that you do have localized resources as well. So I know in my old cluster we had a self-referral for physiotherapy. So if you do want a localized resource, you can add to that as well. So we've got all the national databases which we build for you, but you can add your own localized resource as well, and you can just type that in there. So for us now, it would be self-referral to physiotherapy and podiatry services. You can put that information in there, and on the telephone numbers and how patients self-refer. Then when they do look for it, they can search that in the app then. Your surgery, when patients click on this, it's information about your surgery really. So when patients download the app, they download it for your surgery. It's not a generic app. So again, patients can call the surgery and email the surgery. Now I know some surgeries don't like patients to email them. So if you don't want to do that, again, you just go back into your dashboard, and then you simply, where it says email, delete the email address that's present, save that, and then go back into the app if we refresh it and go back onto the My Surgery page, then you can see that the email has been disabled. Patients can call you, they can see your opening times, and if you do have branch surgeries, you can put the branch surgery details in here. Again, you can do that from your app dashboard, and it's very easy to do that, and you can list the branch details, phone number, email address there. Patients did feedback that they wanted to know what practice teams' areas of responsibilities were. So again, we've put in the app details about the responsibilities. If you've got team members, you can say what doctors do. And the team members, you can put photos in there if you want, but that helps patients with familiarity of team members. Again, out of hours, some patients didn't like the fact that they had to phone the surgery and then get redirected to out of hours. We've put an out of hours page on there for patients. It tells them when they should phone the out of hours 999, and if they call that number, it will enable the phone to phone the number. And then of course there's the you can put in information about the out of hours telephone number. If they phone the number, that will take them directly through to there, and there's a website also that can go through NHS Wales 111. If you do offer private services, I know in our surgery we do, you can list the services you offer, and again the price list, you can populate that again from your dashboard. It's pretty easy to populate. We've built a template for all practice managers with a list of all the non-NHS services you provide, and you can put your own price list there, and that then avoids complaints if patients have procedures and they come back to reception and they didn't know that there was a charge. You can also put your payments procedures there. Then there's other pages you can put on there. There's links to your websites and all your social media feeds in a hope to get your social media sort of feeds with more patients. Again, patients wanted to know what's going on in the surgery. So we've built a what's on calendar within the app. So you'll see here there are titles at the top. So if patients want to know what's going on, such as flu clinics, they can click on flu clinics, and then they can see then what days you're holding flu clinics, and they can click into it. They can see details, and if you do allow online booking through My Health Online or another booking system for flu clinics, they can click the form to book an appointment, or you give them instructions of how to book appointments. Is it just by phoning you? Again, they can narrow it down by coronavirus clinic, or they can show all, but they can see then exactly what's going on in the clinic, in the surgery. If we go back to the homepage, then a lot of clusters wanted to be able to have a cluster page within the app. So we've built a page dedicated to the cluster within the app, so patients can click here, and then that tells patients exactly what your cluster is all about. So you can give information about the surgeries in your cluster, what your cluster priorities are. Patients can click here and see a short video about what clusters are, which we've produced. That's in English and in Welsh. And then there's a news section about anything that's happening in the cluster. You can put up there any project you've got at the moment going on in the cluster. So sort of, we've got carer support or local area coordinators or loneliness, whatever your projects are, you can put that, and you control that again from your dashboard. Again, you can put upcoming projects. So what you're trying to achieve in the cluster, you can advertise that to patients as well. And there's a social prescribing hub. Now, we are working with link workers in England and social prescribers in Wales, because they say that patients will not necessarily know what social prescribing means. So we're looking at a new title for this to make it more user friendly for patients. But if they click here, they can then see what's available in your locality, cluster locality, and in the practice from the third sector and link workers or social prescribers or care navigators, as it were. And they can click to see details then on everything. So you can build that yourself, or we can build it for you, and then so they can see what's going on. So that's the app from a patient point of view. In February, there is an update coming out for the app, and there'll be another button here called My Health, and that will allow patients if they are on repeat medication, they can favorite that medication they're on from the list of BNF, which we link with, and then that will allow patients to set themselves reminders of when to take the medication, but also when to reorder. So if patients had a medication on the 1st December, it's up on the 28th of December. 7 days before then, it'll remind the patient, right, your medication is starting to run out. Phone the surgery or phone the pharmacy or book an appointment and reorder your medication. Same with annual reviews. if patients do have chronic diseases such as diabetes, COPD, asthma, and they need to come into clinic with you, then they can set themselves reminders 3, 6, 9 months, 12 months, and 1 month of when their annual review is due, and it'll remind them 7 days before, or 7 or 14 days before, to phone the surgery to book their annual review appointment with you. And we're working with GPs to add in more things which patients can record in there, such as BP, weight, HbA1c. So we're working on that at the moment. Okay, this is back to the dashboard. These 4 sections here are what populates your app, and then the 5 here are what controls your app. So app users, you can see a list of total app users. You can see this is our test patient. At the moment, we have 7 test patients here. Registrations is where your registrations for My Health Online will come to. You can download them all. Notifications. So notifications are pretty big feature that patients wanted, and it's pretty useful for practices as well. So if you want to send notifications out to a patient, you can click on send. And on the left-hand side, these are notifications used by all practice managers, Wales or UK-wide, so you can see what other people are sending. On the right-hand side, these are notifications that are specific to your practice only, and you can set up notifications in the setup section. It's pretty easy. Just click on Add New, and then put a title and the content you want to save you having to retype notifications which you would use regularly. So if we were to send one out today, let's this is a pretty pertinent topic now, COVID-19 vaccine information. We can click use. We've populated this for you based on public health information, and then that populates the notification, and you can link it to a page. So we've built a page all around COVID-19 vaccination, so we can send that out now. So we just send that, and then that's sent to every patient in your practice who has the app. So if you go back into the app now and we refresh it, you can see in the top right hand corner here, the patient would get a notification if their phone is closed on their desk. A notification would come through as it would with any other application. But once they open it up, you can see that the patient would open it up here, and they can see COVID-19 vaccination from Grange Road Surgery. They can see the full text, and they can then read more, and that would take them to an additional page about the vaccine. So they are well informed, and this is information from Public Health Wales or Public Health England about the vaccine eligibility, patient information. So you can link to loads of stuff just through one notification very quickly. And if you go back into the app, there's an audit trail for your notifications sent. If you click on history, then we can see that today at 1:16, we sent out a COVID-19 vaccine information that's been read by the 3 devices we have active for our test app. Again, if you wanted, we do run patient surveys again. So if you are running surveys on a practice or a cluster-wide basis, we can run them for you digitally. So we can build a digital form for you in the app, and the patient, and then we can send that link out to fill out the application, the patient survey within the app. And to do that, it's pretty easy. You can just go again to send, and we can write a one-off one now. So we'll write patient survey. And then we can put in whatever text you want, and then again we can link a notification to a patient survey. So we can click send that out, and again that's gone now to every patient who has the app in your practice. So we can see there, and the patient survey, please click on them. That'll take them then to the patient survey that we've built for you within the app, and then we generate a report for all that, or each patient that's been that's completed the form. We can generate it on a patient by patient basis, or if you want to just a report as with patient anonymous, and just a report, we can do that for you as well. We can do that on a cluster-wide basis or a practice-wide basis. If we go back into the dashboard again, you can see page views. So when we're building this, practice managers wanted a user feedback, so you can see what patients are doing within the app. So if they are clicking on, you can see what's being used most. So you can see that here the triage button, a link to eConsult or Ask My GP has been clicked the most, and the last whatever, it's in a descending order really. So you can get big data, then you can see, make informed decisions of what practices, what patients are doing within the app. We do offer tiered login. So this is a login for practice managers, but we can log in as a cluster lead as well. So cluster leads have their own login, and they populate the cluster page, and they can put out pages, they can put out news posts, they can update projects and upcoming projects, they can put in social prescribing. You can also cluster leads can also contribute to the what's on. So one thing the practice manager wanted to avoid was the work landing on the practice manager's desk solely. So we want to distribute the work evenly. So if there's a what's on information, I don't know if the cluster has if you're organizing a cluster coronavirus clinic, the cluster lead could then put a what's on section out to say that they are organizing a coronavirus clinic as a cluster, and that would then appear in the what's on calendar. So again, you can do it as a cluster basis. You can send notifications out as a cluster. So if you've got information you want to send to your whole cluster population, and it needs to be everybody and not just a practice specific, you can send notifications out again, similarly as we did to the practices, but again the whole cluster. And again, page views, you can see this now. So a cluster manager can log in and see what's happening with the app on a cluster-wide basis, and they can narrow it down then to practices within the cluster, but they can have an idea of what's happening on a cluster basis, particularly with regards to health resources. And then we also do have tiered login for social prescribers or care navigators or third sector operatives. So but they can only update the app for social prescribing and for what's on. So they've got limited access to what they can put in the app, because that's the way we've built it. So yeah, that's the app in a nutshell. If you do have any questions, please do let me know. Any questions so far? No questions from anybody? Okay, if you did want another demonstration, we can do this again. If you wanted to get in touch with us, just visit our website, www.mysurgeryapp.co.uk. This is recorded, so we will put it out. We do have other webinars this week and next week. So thank you for attending, and we hope to speak to you soon.